Joining me now to discuss this further, New York Representative Anthony Weiner. Good to see you this morning.
My pleasure, thanks.
So what do you make? You obviously been very involved in healthcare issues for a long time now, going back to your time on the City Council and continuing through your service in the House. I know that you've been a strong advocate of single payer. Right. Now it looks like Republicans are walking away from the table. A couple of the members of the Gang of Six, Mike Enzi from Wyoming, for one, and perhaps Chuck Grassley in some ways seem to be wavering a little bit based on the letter that was sent out and some other comments. Does that say to you that Democrats now need to much more aggressively close ranks and try and do this on their own?
Well, Carlos, you know, for them to have said goodbye to the negotiations implies that at some point they sat down and said hello. I don't know if they ever really did. You know, we've kind of gotten to this formulation that there's this group of 6 senators who are going to try to decide the future of health care. Well, you know, we have never really shown any real indication that they want to find compromise. John Kyle, who's the whip of the Senate, said he doesn't think there should be any Republican votes for this thing. The problem clearly is that the Republicans have made a strategic decision, I believe, in Congress. Not some Republican citizens, who I think really do want to find a solution, but their representatives, frankly, have said not allowing President Obama to have accomplishments up on the board is part of the way they think they get ahead. They're not really looking to solve this problem, so I think it leaves it to us, the Democrats, who have the House and the Senate and the presidency, to try to fashion the best deal that we can, and that includes having a single-payer option. Look, this is a stupendous opportunity that we have.
Do you think single-payer option, which President Obama said during the campaign and previously in his career, which is the way he wants to go, which is maybe best represented by what Canada does, he said that's what he'd like, but he doesn't think it's politically feasible. Do you think reasonably that single-payer could return to a conversation, if indeed, as Bob Dole says, you hit the restart button and you start conversations afresh?
I certainly hope so, but just a minor correction. I'm not saying do what they do in Canada, do what we do in the United States. You know, we have Medicare as a single-payer system with very low overhead. You know, it's got a financing problem, but so does all health care at this point. We don't have to look that far. 20% of all Americans and 40% of all health care dollars come through a single-payer, government-run program that has very low overhead. And it has low overhead because we're not looking for profits. We're not looking to pass along money to stockholders or pay big bonuses. So I think we're going to have a chance to have that conversation again. I think the best way to put it is the way you put it. You know, kind of hit the reset button and say, let's take a step back and see what we've had problems with. Part of what we've had problems with, it's been pretty complicated. Single payer is not.
Maria, what does Wall Street say about this? Because so often Wall Street is betting on outcomes and what they think makes sense. What is Wall Street saying, and how are they betting with their money, whether it's on the insurance companies, the pharma companies, some of the publicly traded hospital companies?
Well, you know, I think that one thing is for sure, whether it's Wall Street or throughout business, and the expense of health care continues to soar. And this is really the single largest expense for corporate America, and that includes Wall Street. Now, you know, within Wall Street specifically, when you look at the health care stocks, you actually did see the insurance companies under some selling pressure because of the idea of a public plan. But I think broadly speaking, you know, one issue I would take with your explanation there is that I don't necessarily think that, you know, the Republican representatives don't want to get a deal done. I mean, I think that in some corners they are listening to their constituents. I mean, there's a reason we're hearing all these town halls, right? I mean, people are waiting on detail, and they want to know what this means for them. And so my question would be, how is it possible that you actually do envision costs coming down? Because, I mean, I think people want to figure out what a public plan would mean and how is it possible. So if you look forward and you say, okay, let's say we have the same number of doctors out there. I would say you probably have fewer doctors because, you know, fewer and fewer people are going to medical school, frankly, because of the economics of it. So let's say going forward we have fewer doctors, or at a minimum the same amount of doctors. You have more people under the umbrella, right? You have 47 million additional people under the umbrella. So how is it possible that you have more people under the umbrella, fewer doctors, and you're going to charge less? I don't get that. I don't see how that
makes sense. First of all, predicating your question is a false assumption. We're going to have fewer doctors. One of the things we do in the legislation, we increase the amount.
Congressman Weiner, can we make this a tease? We're going to take a quick break and allow.
When I come back, you'll be hearing all about how we solve Maria's quandary.
And we're going to do a little fun fact. We're going to talk about who your original New York roommate was.
Oh, okay.
That's a little fun fact when we come back.
But that's someone else's product. But all right,
that's someone else's product. Okay. All right, we'll be back in just a minute. When we come back, we'll talk about whether or not President Obama needs to make a fresh start on health care. Send me some of your thoughts. Log on to our website. Go to twitter.msnbc.com and follow the link to my Twitter page. Up next, we'll hear from Congressman Weiner that answer. In fact, we can lower costs and whether or not bipartisanship is dead in Washington. You're watching MSNBC Live. I'm Carlos Watson. Welcome back to MSNBC Live. So our hopes for a bipartisan deal on health care dead. Now, one Republican senator seems to think so. The White House is taking aim at Senator Mike Enzi for seemingly giving up on efforts to reach a health care compromise. Joining us now to talk about all of this once again is Congressman Anthony Weiner. We're also joined by Ezra Klein. Ezra writes a blog on economic and domestic policy for the Washington Post, also by Maria Bartiromo. Congressman Weiner, I'm going to go back to you. We had a little tease right before the break. Maria was asking the question, with arguably fewer doctors, arguably covering more people, how in the end do you ultimately get healthcare costs lowered?
Well, listen, she's exactly right that there's a structural problem. We need more primary care doctors. In the bill, we're adding incentives for those doctors, increasing the number of teaching hospital slots. But one thing I think we all need to keep in mind, all Americans are getting health care today. Just a lot of them are getting it in hospital emergency rooms and passing along the bill to you and me and the rest of the taxpayers. So what we're trying to do is say, listen, that's not the efficient way, that's not the inexpensive way to do it. The more inexpensive way to do it, get them checkups, get them preventative care, keep them out of hospital emergency rooms. So that's one way. But the second way is this notion of competition. Look, if you have one or two insurance companies operating and suddenly there's a public plan that comes in with lower overhead costs, they can bring prices down, I guarantee you the private insurance companies are going to try to compete by lowering their price.
But how do I know the quality is the same? How do I know the quality? You look at a plan like the UK, right? Public plan in the UK. Do you know that if you have cancer and you need the most effective, most popular cancer drug, Erbitux, the government says, no, we're not going to pay for it. It's too expensive. And it is expensive. It's $38,000 for 16 weeks. So how do I know the quality doesn't suffer?
Can I say, listen, Carlos talks about Canada, you talk about Europe. Let's talk about the United States of America. Medicare.
You have to look at where there are public plans.
No. The United States of America, 40% of all tax dollars go through a public plan. Ask your parent or grandparent, ask your neighbor whether they're satisfied with Medicare. Now, there's a funding problem, but the quality of care is terrific. You get complete choice. You can go anywhere you want.
How come you don't use it? You don't have it. How come you don't have it?
Because I'm not 65. I would love it.
Yeah, come on. You have a better health plan than everybody else.
First of all, that is 100% not true, and I have to stop you there. Federal employees, from the janitors to congressmen, have a government plan that is okay. It's not. I wouldn't complain about it. I want the cheapest plan because I'm young, I'm healthy. Medicare for someone age 45, I would take it a beat, and frankly, so would you, because it's an excellent plan. If you don't believe it, ask anyone who's on Medicare.
All right, hang on a second. Let me bring in Ezra Klein. Ezra, your thoughts as you hear this, because there is, as Maria said in our earlier conversation, there is real skepticism. It's not just Republican lawmakers. There are voters out there that have some skepticism about the notion that change is either going to lead to better health care or less costs.
Sure. I mean, look, I think we can say what we've tried is a status quo, and that didn't work out at all. The congressman is right about Medicare. Seniors have about 94% satisfaction with Medicare, while employer health insurance is significantly lower.
Let me push back on you just for a quick second.
Please.
Because there are some who would say, actually, it has worked out well enough for them so far. And they would argue that they're fundamentally happy where they are. It's not perfect, but they would say, you know what, it has worked out for me. And if you change it, I don't necessarily feel good that I'm going to get to see my doctor more often than I am now, or that I'm going to pay less than I am right now.
Sure. So you get into two or three things here. One is that for most of those people, there's no change. I have employer-based insurance at the Washington Post. I couldn't buy into the public plan if I wanted to. Not only will there be no change for me, like by law, I'm not allowed to change it myself. So let's put that on the table first. Second, I mean, the fact of the matter is it's unaffordable. I mean, it's not whether or not you like it, but in 10, 15 years, we simply can't afford it. Eventually, it's 33% of GDP, and then by 2082, we're talking about healthcare costs at 100% of GDP. Obviously, something will happen in between now and then, so we don't spend every dollar we produce in this country purchasing healthcare. And the question is just going to be what happens and how do we change it. But one thing that it's a little bit like Buddhism, right? You can't get away from change here. Eventually, there will be change. The question is simply how will it look and how will we do it? And sort of a lot of this scaremongering, I don't think is going to be a good way of getting us to a productive new system in the long run.
So Ezra, we've got to go right now. We're going to take a quick break. I'm going to ask you guys actually all to stay around. We're going to extend this. We're going to extend this fund and come back and talk about it more in just a moment, because I want to hear what plan you think, Ezra, among others, you could give Republican support for. Maybe you'll say there's no Republican support out there at this point, but I want to hear it when we come back.